Hello, this is Daniel Rasmussen, East Asian medicine practitioner and founder of Pinnacle Integrative Health. And thank you. Um, we're so honored that you're taking the time to check out stem cell therapy and regenerative medicine. And we're going to be talking about our stem cell therapy program and regenerative medicine that we do at our clinic, Pinnacle Integrative Health. Stem cell therapy is really in the news a lot these days, and you're, a lot of reports are out there about its treatment of persistent pain and for people who want to avoid joint replacement surgery and when other therapies have failed, such as the temporary treatment of cortisone injections and even failed physical therapy, acupuncture, non-steroidal anti-inflammatory medications. When all those have failed, then a lot of people are sort of kind of waiting around until it gets bad enough for joint replacement. And now there's another option, actually. Instead of replacing your joint, just imagine if it were possible to repair the joint non-surgically or repair the tissue damage, the disc, repair muscle, ligament, tendon, and even bone. So we're going to be talking about that today in this presentation. So a little bit about Pinnacle Integrative Health and Regenerative Medicine. We were founded in 2010, and from the start, we've been a holistic, integrative, and regenerative medicine practice. We've got a team of specialist physicians, a nurse practitioner, and East Asian medicine practitioner, combining the best of the Western medicine and science-based Western medicine with the ancient medical traditions of the East. This forms a very comprehensive approach to regenerative and integrative medicine. And we began offering specifically stem cell therapy and platelet-rich plasma, or PRP, in 2014. Since then, we've treated over 274 cases, and we've had a very good success rate, 97% success rate. And we'll talk about a little why there's the kind of a 3% non-responders. It's has to do with their lifestyle, their individual basis, and their results that they get. And we see about 15 to 20 stem cell and or combination PRP, platelet-rich plasma, patients per month. So we got a very very happy patient outcomes with the results that we're getting. So what we're and I myself, I'm not the physician that does the treatment, but I am the founder and of Pinnacle Integrative Health, and I've gone through a lot of training in this and research. When I was in school, I did some research papers and wrote about stem cell therapy, and just have really followed this whole therapy since it was really started in the late 90s, and kind of got shut down in the U.S. as far as the controversial embryonic stem cell therapy. And we're not, I just want to preface this is not referring to any embryos or embryonic stem cell therapy. Today we do not deal with, there's no ethical issues with the stem cell therapy these days. It's come a long way. So we're going to get into that. But we do have physician and a nurse practitioner who on our team who are specialists in the regenerative medicine, and those are our providers that we have. So what you're going to learn with this presentation here is, where do we source the stem cells? What are mesenchymal stem cells, or MSCs? How MSCs do find the tissue and home in on, what's their homing action? How do they know where to go? Excuse me. And how do the MSCs induce tissue repair? It's very interesting. What's the mechanism there? And we're going to look at the young versus old MSCs. Again, MSC stands for mesenchymal stem cells. And are MSCs safe? So some of the options: conservative, conventional medicine, the rest, ice, compression, elevation, and NSAIDs, physical therapy, acupuncture, chiropractic. Then secondary therapies are things like electrostimulation therapy, steroid injections. Then we start moving to the regenerative therapies such as platelet-rich plasma, which has some amazing therapeutic properties and regenerative properties to it. And that we have another presentation on that on our platelet-rich plasma page on our website, but we're going to be focusing mostly on the stem cell therapy with this presentation. And then you're looking at surgical options, release or repair, meniscal tears, and then finally total joint replacement. So a little bit about where we source our stem cells. We get them they're basically umbilical cord tissue stem cells, and they're really just a very ideal way to go. Cord tissue has been used in a variety of clinical settings since the early 1900s, actually. And this is placental tissue and amniotic tissue as well. And there's been no reported adverse effects. It's a pretty straightforward injection procedure. We simply inject. There's no additional equipment or reagents needed. And our average patient sees relief in 24 to 48 hours as the anti-inflammatory effect kicks in. Some of the comparisons of the different sources of stem cells, MSCs. So we've got the first line there, umbilical cord tissue, and it's taken from it has anti-inflammatory properties, antimicrobial properties, growth factors, and no toxicity, and pluripotency, which means can divide into any of the 214 different tissue types. Then we got platelet-rich plasma, PRP, and its source is from your own blood. Platelets are extracted and mixed with an aggregator and activator complex. It's anti-inflammatory. It's not as antimicrobial, minimally. It's negligent, basically. And it does contain growth factors, no toxicity, but no pluripotency, because there's mostly just the growth factors and the anti-inflammatory platelets, so it's your own body's healing mechanisms that are being kicked in there. And then you've got the synthetic steroid, cortisone. It's very anti-inflammatory, not antimicrobial, no growth factors, but there is a risk for toxicity and bone loss of 8% in a year, localized, and softening of the chondral tissue, which is your cartilage. It actually accelerates the wear and tear, leading to a faster. It's kind of like putting battery acid in the joint. Then we've got hyaluronic acid, which is synthetic, and it's just basically a fancy lube job for the knee. It's temporary. And then we've got adipose derived stem cells taken from your fat tissue, from your own body. It's not anti-inflammatory. It's not antimicrobial. There are growth factors. There's no toxicity, and those are pluripotent. And we do kind of a mixture of, based on individual cases, we do the umbilical cord tissue and adipose derived. So a little bit about the source of umbilical cord MSCs. So they're obtained during a live, healthy C-section birth. Mother was screened for medical history, consent from the family for donation, and mother was tested for over 114 different infectious diseases before the tissue can enter into the tissue bank. The cord is tested for infectious diseases and sterility, and only actually 1 in 10 pass inspection for concentration in stem cell and the appropriate growth factors and cytokine and interleukins, which are the really the activated components of this regenerative therapy. And then the mesenchymal stem cells are collected and cryopreserved until thawed in the clinical setting, which we place an order. It arrives in our office and in a box, styrofoam box, and dry ice, and we quick thaw it, and once it's thawed out, it's ready for an injection. We mix it with a little bit of saline solution and very simple one-time procedure, usually in office, and there's no downtime. You might hang out for 15-20 minutes just to give the stem cells a little bit of space to work into the joint, and then you're off. There's a little bit of maybe 2 to 4 weeks of light duty downtime. So a little bit about the cryopreservation methods. So this is a study that was done, cryopreservation of human stem cells for clinical application, and a review. This is from the NIH.gov website, and it's basically concluded that MSCs, or mesenchymal stem cells, from bone marrow and cord tissue are cryopreservable by the methods used to cryopreserve their hematopoietic analogs, which are basically stem cells that produce blood, produce more blood cells. And they do a slow freezing protocol utilizing DMSO, which is basically it protects the cells from damage as everything freezes, and as it's a cryoprotectant basically. And this is a very common, been deemed safe. Recent studies by Liu et al. Have confirmed that 10% DMSO and slow cooling, rapid warming does not affect the viability or differentiation potential of cord tissue and adipose-derived stem cells. And mesenchymal stem cells are not irradiated before cryopreservation. They are considered minimally manipulated. So we got two major categories of stem cells. We got CD34 plus, found in bone marrow and circulatory system, and they supply production of your bone marrow. And they're actually called pericytes. Pericytes, not parasite, but a pericyte, which means it attaches around structures. And they are the progenitors, or they actually will turn into a stem cell once they detect tissue damage. And then the mesenchymal stem cells are the second type. These have pluripotency, which they can differentiate into more than 214 different tissue types. They're found in bone marrow and throughout the body in the vascular tissue, the umbilical cord, placenta, amniotic tissue, and even in the dental pulp of your teeth. And they secrete growth factors that promote new tissue growth and activate adult autologous stem cells. So once they're introduced, those activated MSCs will actually recruit more stem cells when there's a tissue injury. So it explains why when kids have an injury, they heal very rapidly, and why that slows down when we get older. We're going to go into that in a moment. So here's a picture of some of the pericytes, cells on the capillaries in tiny little microvessels. And all mesenchymal stem cells are basically pericytes. It's just an interesting, those little pink dyed areas are they latch on around these tiny little blood vessels, and that's kind of an example of where they hang out and just waiting for tissue damage to repair the tissue. So this is the mesogenic process. MSCs were coined as the term by Dr. Arnold Kaplan, PhD, as he called them the injury drugstore, because of this different process of whatever tissue injury occurs. They can differentiate into basically bone marrow, bone, cartilage, tendon, muscle, and fat. And then from there, they can differentiate into ligaments, cartilage, etc. So this is just a flow chart of how they actually flow into and become different specialized cells based on their environment. So here's an example flowchart again of Dr. Arnold Kaplan's findings. They start on the pericyte, and then they move to a mesenchymal stem cell, mesenchymal, and then they become an activated mesenchymal stem cell, MSC, and then finally a medicinal, which is from there they have trophic and immunomodulatory effects. So if they go toward the trophic means anti-apoptotic, which help prevents um, uh, cell death. They break down scar tissue. Angiogenic, meaning they can form new heart tissue. And mitotic, also in the mitochondrial environment. Regenerative microenvironment, and then also they found that the medicinal MSCs also regulate your T cells, B cells, dendritic cells, and T Tregs, which are all immune system cells. So it has a modulatory effect. If it's too weak, it brings it up. If it's too highly overactive and autoimmune condition where it's attacking someone's body, it can reset the immune system and calm it down, putting the autoimmune condition into remission. It's very interesting. How do stem cells repair damaged tissue? How do they know where to go? Well, these when your body is injured, it releases chemokines, and these chemokines are little markers that attract the adult stem cells, and these MSCs circulating wherever we inject them seek out the chemokines, and they're basically the little homing signals. And then they will move on to that tissue, and once they latch onto it, it becomes specialized to that type of tissue. Whatever it touches, it now gets a signal from its environment that it's that new type of tissue, and it literally will start to regrow and repair and build a new lattice and scaffolding and structuring and filling in the tissue and repairing it. Here's a picture of some mice that the one on the right there had a big tumor, and they injected the stem cells into the mice and in 24 hours did a imaging, MRI imaging of the tumor, and in 24 hours it shrunk the tumor. So these showing how the human umbilical cord tissue, MSCs, migrate toward tumor, partially regulated by signal chemical chemokine called HMGB1. So this is very interesting. Compare this to adult stem cells, which are taken from bone marrow aspirate, which have, the older we get, the higher risk for turning into tumors. So there's some of the studies show that that's an issue with bone marrow aspirate, taking stem cells from your bone marrow, which is one of the reasons why we kind of went away from in that direction. There's a higher risk for creating tumors, as opposed to the young, very vital umbilical cord stem cells. So this is a little depressing. As we get older, our stem cells decline with age. So when you're a newborn, you got 1 in 10,000. As a teen, we go from basically this little 7-pound baby and all these stem cells, and then we start growing into however big we get. And now there's fewer stem cells to go around, and they actually decline in concentration. And so this is one of the reasons why it takes longer and longer to heal as we get older, is because there's fewer stem cells to do the tissue regeneration and healing and repair. And that's also why we form more scar tissue when we have an injury, as opposed to a little kid who has lots of stem cells and it can regenerate the tissue without scar tissue formation. So this was a study done also comparing young human umbilical cord tissue stem cells with fetal, adult, and aged, and they actually show that the doubling time is for an aged and adult is about half the time. So in about 24 hours, fetal stem cells, which are younger, which is comparing that to the human umbilical cord tissue stem cells, which is what we do in our clinic, It only takes 24 hours, roughly 24 hours, for them to double in number, whereas adult and aged stem cells can take up to 2 days or 2.5 days. So you're not just looking at doubling time, and it's an exponential curve. So doubling roughly, they found that the human umbilical cord tissue stem cells can roughly double 50 times versus adult stem cells, which only might double 10 to 12 times. So this is exponentially, um, this is a factor of 10, multitude of 10, uh, where we're getting dramatically more stem cells and tissue and more work. And the more tissue, more stem cells you have, doubling, the more work they can do. Um, There's also, so this is talking about the studies that were done with age-related adult autologous stem cells taken from your own bone marrow, and they basically looked at these stem cells, and they looked at how the older we get, the less fit they actually used the word fitness, the age suggesting a loss of stem cell fitness the older we get. And it just makes sense. The older we get, we're not as fit as we were when we were younger, and that's true for our stem cells. They just don't. They're a little harder to get going, and this is where it might lead to problems that using adult bone marrow stem cells that are aged for cell-based therapies. They're referring to the potential for forming tumors there. Dr. Lee et al. In the University of Buffalo, New York, noticed that what it is, the mechanism of action of the stem cells is actually based on, so they did this study where the first study they did a hamster model of heart failure, where they induced heart failure in this hamster, and then they gave them MSCs through IV, and the heart failure improved dramatically. But then when they measured the new stem cells in the heart, there was a very small percentage of them that actually made it to the heart. So they started wondering what is it that's causing, if there was no stem cells in the heart that repaired it. So they did another study, same thing, induced heart failure, and this time they injected the stem cells into the leg muscle, and they stayed there. And after a period of a few days, the heart failure still improved dramatically, at the same rate as the initial injection through IV. So then this Dr. Lee did a third study, and he thought, well, he's going to culture. He thought he'd culture the secretions, and thought maybe it's the secretions that these stem cells are putting out. So he put the stem cells into culture, and then drew up the secretions, and three times a week kind of mimicked. He would inject the secretions of the basically cytokines and growth factors that were produced by the stem cells, and he injected this into the leg muscles of the hamster, and the heart failure improved at the same rate. So they basically discovered that it's not just the stem cells becoming new tissue and getting in there and becoming whatever, but it's the concentrated secretions or discharges, the products made by the stem cells, which cause massive multiple anti-inflammatory effects and influence tissue matrix turnover, which is basically saying stimulating your body to start turning on its regeneration and new growth of tissue on a massive scale. And the safety of human umbilical cord is almost unmatched. There's been thousands of cord transplants in the U.S. for bone marrow reconstitution after chemotherapy, and this is a very standard therapy. It's deemed extremely safe. There's been whole cord blood, which was standard for transfusions in the U.S. in the 1930s. And then Lancet Journal in 2003 did a study where 128 patients were given cord, blood, and tissue with no adverse effects. And then in 2005, there was a study where 413 units of cord, blood, and tissue were given with no adverse effects. So they seem no immuno rejection. Basically, these are immunoprivileged cells. They're so young that there's no proteins that trigger your immune system to recognize anything. So there's been no chance of rejection, and they're extremely potent and very vital. There's now 85 clinical trials being performed using allogenic, meaning donor, stem cells for a variety of conditions. All have been approved by ethics committees who weigh the risk and benefit ratio to patients, and they've been deemed safer than conventional medications and surgical procedures. So the worst thing that can happen is nothing at all. And that's the worst outcome. And in that case, maybe a very small percentage of patients are non-responders. It is also umbilical cord tissue, amniotic tissue, and cellular products. All of these products are FDA regulated as a human cell tissue or cellular tissue-based product so it's FDA regulated. And some of the conditions that are treated in our clinic with human umbilical cord tissue stem cell therapy, basically anything with Achilles tendon tears, ankle sprains, arthritis, degenerative, just about any joint, cartilage defects, facet joint syndrome, knee pain with arthritis and tendonitis, hip pain with arthritis and tendonitis, neck pain, runner's knees. Really just looking at anything that's orthopedic related, we've had very good outcomes with this in the regenerative approach. So it's been very, very successful. Some of the sources, these are some interesting sources. The studies that were done for cartilage regeneration by human umbilical cord tissue stem cells could lead to the ultimate knee and hip replacement. So over the past several years, they've noticed that they've been investigating the regeneration potential of human umbilical cord derived stem cells in a hyaluronic acid composite hydrogel, and it's been shown to have remarkable results for cartilage regeneration in rat and rabbit models. And now they're doing this it's in the clinical trial phase. This second study here, recent advances in our understanding of the functions of MSCs has shown that they also possess potent immunosuppression and anti-inflammatory effects. So this is where it can have a very powerful effect on arresting inflammation and treating immune issues and modulating the immune system. Some other studies: local adherent technique for transplanting stem cells as a potential treatment of cartilage defect. So they've basically noticed that these in rabbit models, the intercellular adhesion molecule had positive cells increase between 1 minute and 10 minutes, neutralizing the antibodies for intercellular adhesion molecule and vascular cell adhesion molecule 1, activating leukocyte cell adhesion molecule inhibiting the attachment. So it's basically saying that it's attaching to the tissue that needs repaired, and then basically causing treatment to the cartilage, or regrowth of the cartilage. Second study is MSC stromal cells in rheumatoid arthritis, treatment of RA, damage to the joints from RA. Then we got meniscal studies that were done on meniscal tears in the avascular zone, which means very little blood circulation is getting into the area where the meniscal tear is. And they've studied that their conclusion was tissue engineering with MSCs and a hyaluronan collagen-based scaffold is a promising approach to repair meniscal tears in the avascular zone, as opposed to just clipping it away and cutting more and more meniscus away, and leading to an accelerated knee replacement. The second study is human umbilical cord tissue, HUCT, stem cells applications to tendon healing. And they concluded that in the stem cell treated groups, there was a significantly improved healing histologically with a higher collagen type 1 to type 3 ratio and improved fiber orientation compared to the controls. So they histologically means tissue changes. So tissue growth occurred. So we got the conclusion. The research is solid on this, and it's human umbilical cord donated tissues is um, really one of the most effective in terms of comparing it to the other forms of stem cell therapy. You've got your own bone marrow and adipose derived, which are collecting your own stem cells, which are older and they're more likely to have problems down the road, creating tumors potentially. But with these younger umbilical cord tissues, they're just basically brand new and they're high concentration and secreting all the cytokines and growth factors, which also activates your body's own and recruits more of your own body's stem cells while it's in the tissue. So it's just one of the things that has been a fantastic therapy for us in treating these conditions. So how do I find out if I am a candidate for stem cell therapy? Well, first you've got to provide your contact information for us on our website, pinnacleintegrative.com/contact, and provide a few details about the condition which you're wanting treatment. Then we'll follow up with you and we'll get you scheduled for a consultation visit. Stem cell therapy is not covered by any insurance, but the consultation visit may be covered depending on your insurance, so bring your insurance card with you. Otherwise, there's a small fee for the consultation. I think it's somewhere around $20 for to get the consult. And sometimes we offer complimentary consultations depending on what's going on. And if you qualify as a candidate, we'll be very transparent. We'll let you know whether you're a good, a fair, or a poor candidate. And you'll be given recommendations, and all costs and financing options will be discussed on that consultation visit. That does it for our presentation here. I know this was a lot of information going through this fairly quickly. I tried to break it down, and we kept it to about 30 minutes here, but let us know how we can help. Thank you so much for joining us, and we'll go ahead and close it out. Thank you.